This is really my pleasure and honor to give the presentation on this COVID-19 vaccine policy, coverage, and real-world effective data in Asian Pacific countries. And just as mentioned by this Lancet COVID-19 Commission, it described this, the COVID-19 response is a widespread value at multiple levels worldwide, and which has caused millions of preventable deaths and reversal in progress toward the sustainable development of many countries. And the failures, including the failures of prevention, rationality, transparency, not following this public health, normal public health practice, and also failure of operational cooperation and international solidarity. And more importantly, at the national level, most countries, most governments have ill prepared and also have too slow in response and also pay little attention to the critical situation. I think during this epidemic the situations, I would like to say that for the COVID-19 containment or mitigation in any country can be stratified into three phases. The first phase is we are trying to use a non-pharmaceutical intervention, NPI, to prevent local transmission. That's before the vaccine received the EUA on December 1st of 2020. At the aim of the phase one containment is try to reach the goal of zero COVID-19. And this is true in many Asian Pacific countries. And during the phase two stage of the COVID-19 containment, the mass vaccination were used to increase the population immunity. Of course, NPI remain very important. And this period, I would like to say is between December 1st, 2020 to November 30th, 2021, just before Omicron variant spread out. And the aim of this effort is try to reach the zero COVID-19 and also the rapid increase of vaccination coverage. During this phase three, we are using this booster dose vaccination, rapid test, and antiviral therapies to prevent deaths and long-term sequelae. That's after this Omicron variant spread out. And the aim has been changed from zero COVID-19 to live with the virus. And for the phase one intervention using non-pharmaceutical methods, at that time, I think that in the morning, we talk about the border control and quarantine, as well as the personal hygiene and reporting and testing of suspected cases, isolation treatment of confirmed cases, hospital infection control, cross-contact tracing testing, and home isolation. And also some countries close the school or workplace and even have the travel bans within the country. And the most drastic one is to have a city lockdown. During the phase one intervention, digital technology, artificial intelligence, Internet of Things, machine learning, and even big data analysis have been widely used to assist the practice of non-pharmaceutical intervention. And during this period of time, according to the Oxford University, our work in data, they developed a stringency index to reflect the NPI efforts in each country. And as you can see on this slide, that's before that February 24th of 2021. And in some of the Asian Pacific countries, they had much lower stringency index compared to other countries. And this is especially true in Japan, South Korea, and Taiwan. They don't have city lockdown, they don't close on workplace or school, but they remain to have a so-called normal life in these countries. And as you can see, that during the first phase of the containment of COVID-19, in Japan, Australia, South Korea, and New Zealand and Taiwan, these Asian Pacific countries have lower cumulative confirmed COVID-19 cases per million people than other OECD countries. And this is also true for cumulative confirmed COVID-19 deaths per million. And as you can see on the slides, Australia, Japan, South Korea, Singapore, New Zealand, and Taiwan have the lowest cumulative confirmed COVID-19 deaths among these 42 countries. And this is the estimated cumulative excess deaths per 100,000 people. And similarly, you can see for these 6 Asian Pacific countries have a lowest estimated cumulative excess deaths. This is for the phase 1 intervention. And more importantly, as we can also see during the phase 1 containment period, the economic decline was reversely associated with the GDP growth. In other words, there's as you can see on the vertical axis, this is the cumulative deaths per million people, and on the horizontal axis, this is the GDP growth from previous years. And as you can see, the lower the cumulative mortality rate, and the lower the GDP that's a decline. And this was for the second quarter of 2020. And in US National Bureau of Economic Research, they also published data on the in October of 2020. And this is a similar slide. Just want to show you that the GDP loss percent years was reversely associated with the COVID-19 deaths. In other words, the higher the COVID-19 deaths, the higher the GDP loss. And Taiwan and Japan and Korea, they have a low COVID-19 mortality and low GDP loss. But I think this, during the first 1 period, many countries started to apply this science and technology breakthrough for vaccine development. And this is very important for Asian Pacific countries. And we all know that the rapid vaccine development and rollout is very essential for the effective control of this ever-evolving COVID-19 pandemic. But we all know that a vaccine cannot be lawfully disseminated in most countries without passing a thorough placebo-controlled phase 3 clinical trial. And of course, in order to accelerate this vaccine production, and also for the regulation and licensure and the emergency use authorization, many countries try to shorten this so-called regulation period and review period, and also try to use this immunobridging strategies to license, to give this EUA and of new vaccine. And this slide shows that in many countries, this is in the United States, the traditional timeline for the approval of a vaccine usually takes 10 to 15 years. But during this pandemic of COVID-19, many countries try to shorten this the review process, just as shown on this slide. That's an FDA rolling review and approval and rapid manufacturing are overlapped in order to shorten the period needed for the development of COVID-19 vaccine. And in addition to that, in South Korea and Taiwan, we also use this immunobridging strategies, try to give the EUA of this newly developed vaccine. The reason for that is in Taiwan, we have very few COVID-19 cases when there's an medicine companies trying to produce their protein subunit vaccine. So we don't have enough cases to do a clinical trial, phase 3, and phase 3 clinical trial. That's the reason why we adopted so-called the immunobridging, principles to give this an EUA. And I would like to share with you that by March 30th of 2023, there are in total 183 vaccines is under clinical trials, and most of them belong to our protein subunit and viral vector vaccine, DNA vaccine, and inactivated virus vaccine, and RNA vaccine. I won't go through the detail of it, but in the Asian Pacific country, I would like to say many countries try their best to develop their own vaccine, not only for DNA vaccine and messenger vaccine, and also try to develop the viral vector vaccine, such as in South Korea, and the protein subunit vaccine are the most popular one for these countries to develop. And as you can see on these tables, not all the clinical trials were successful. For example, in Australia, the protein subunit vaccine, only one, reached past this clinical trial, phase 2 and phase 3. And in South Korea, they have DNA vaccine and also the protein subunit vaccine got approval. And in Taiwan, we have Medigen vaccine. They got this EUA approval. And I just mentioned about this immunobridging strategies used in Taiwan and South Korea. As you can see here, that's the BNT vaccine and also the Moderna vaccine. They have quite high level titers of mean neutralization titer. And their vaccine efficacy is as high as 90%. But if you look at this AZ vaccine has a mean neutralizing titer, it's around only half of the people recovered from the COVID-19 infection. And the vaccine efficacy is only around 60%. So we try to extrapolate these kind of figures and using this mean neutralization titer to predict the vaccine efficacy and then issue the EUA for the use. And this slide shows the COVID-19 approvals. And as you can see on the first line, that's BNT. They have BNT vaccine have been approved by more than 100 countries. It's most popular one, and followed by another vaccine that's Moderna, as well as AZ and so forth. And as you can see on the lower one, that's the vaccine of Medigen is developed in Taiwan. It got only approval from 3 countries, and the SK Bio vaccine that's from Korea also only got very low approval. However, if you look at this 6 countries, most of the countries, they don't use their domestic vaccine. Most of them use the BNT or AstraZeneca, AZ vaccine, or Novavax, or Moderna. So in these Asian Pacific countries, as you can see, they formalize this the procurement of vaccine much more than they needed for their own population. For example, in Australia, they have secured 282 million doses of vaccine. And this is in excess of their population a lot. And in Taiwan, we have 23 million people, and we have the vaccine purchased around 68 million. That's 3 doses for each person. And as you can see here, dating back to June 1st, 2021, and this is the COVID-19 vaccine policy in in the whole world. But as you can see in the South America or South Africa and also East Asian country, they all, at that time, the vaccine were inadequate in these 6 Asian Pacific countries. So they adopted so-called high vulnerable group the vaccination policies. Some of them only applied to one vulnerable group, some applied to 2 groups, and some applied to all groups shown in yellow. But this is in 2021, the June 1st, but after 6 months, And in Taiwan, we also have very low, in England, in UK, as you can see that vaccination indeed is very effective to lower the incidence and also the mortality of this COVID-19 cases. And along with this, the increase in vaccination coverage, and you can see there's a significant decline in COVID-19 incidence and also mortality. But when Omicron came, and as you can see, there's a case number is increasing. This is the situation in the UK, and the situation in the United States is similar. As you can see, with the increase in vaccination coverage, the number of 7-day incidence of the COVID-19 declined significantly, and also for the mortality. But after this Omicron spread out, you can see there's a slightly increased in incidence and mortality rate of COVID-19. But in some countries, as you can see in Chile, and at the very beginning, they used Sinovac to do the vaccination. And after 2 batches of vaccination, you can see there's no decline in COVID-19 incidence and mortality. And they changed this, the vaccine brand, and then to BNT, and also that's the AG vaccine. In Taiwan, our coverage is quite low. Even by June 1st, 2021, only 1.3% of the people receive the vaccination. The reason for that, we come across some of the difficulties to purchase, to procure vaccine from other countries. And we always been set at a low priority, because before then, our death number is very low, and we will consider a low priority countries. However, 6 months later, when we got the vaccine, and as you can see here, the South Korea, Japan, Taiwan, Singapore, Australia, and New Zealand, although they will have a low coverage in June of 2021, but by November 16, the coverage rate is increased significantly. As you can see here, that's by December 21st, there's Singapore, Taiwan, South Korea, Australia, Japan, and New Zealand. They already have very high coverage, even higher than those who have vaccination much earlier than these Asian Pacific countries. And of course, it will be very important to look at the correlation between the COVID-19 vaccination coverage and cumulative confirmed COVID-19 death rate. Just as mentioned by David, he described very well about how to use the group data to show this kind of effectiveness. In this slide, on this vertical axis, it shows the cumulative confirmed COVID-19 deaths in 2021. That's from the January 1st to December 30th of 2021. And the horizontal axis is the COVID-19 vaccination coverage by December 25th, 2021. And you can see very clearly that the countries which has the highest, had the high COVID-19 vaccination coverage have the lower cumulative COVID-19 deaths in 2021. And this is for COVID-19 confirmed deaths, because not every death in these countries have been tested for COVID-19. So we also try to analyze the correlation of COVID-19 vaccination coverage and estimated excess death rate, not only COVID-19 confirmed death rate. And you can see the dose response relationship is even more striking for excess death rate, and showing a correlation coefficient as high as 0.62. And this means that at least 36% of this excess mortality can be explained by the vaccination coverage. And the red circle one indicated this, the 6 Asian Pacific countries. They have high COVID-19 vaccination coverage and also have low cumulative excess death rates. And during the third phase of this COVID-19 containment, I think the booster dose and rapid diagnosis and antiviral are all very important. And I just want to show you that in these 6 Asian Pacific countries, the people have a high vaccination coverage and also have very high coverage of vaccine booster. And this slide shows you that by December 31st of 2022, these 6 Asian Pacific countries have low cumulative confirmed COVID-19 deaths and also have a low case fatality rate of COVID-19, and the estimated cumulative excess death rate are low in these 6 countries. So we consider that booster dose was also very important. And finally, I would like to share with you that in Taiwan, since we use 4 different kinds of vaccine, including there's BNT, Moderna, and Medicine, as well as AZ. And in total population of 23 million people, we got this all the information available and then do this kind of analysis. And as you can see that 2 dose AZ or Moderna or BNT or Medicine, they have moderate effectiveness to prevent hospitalization. But if the people received 3 doses of Moderna, BNT, and Medicine, you can see there's an efficacy, vaccine effectiveness is as high as 82% and more than 90% for Moderna, BNT, and Medicine. AZ have somewhat lower effectiveness to prevent hospitalization. And with regard to the prevention of the deaths, and similarly, you can see that AZ has an effectiveness around 60%, and for 3 doses of Moderna, 3 doses of BNT, and 3 doses of Medicine, the effectiveness is they are all around or even higher than 90%. So at the individual level, we define that the very good effectiveness of mRNA vaccine and protein subunit vaccine to prevent COVID-19 hospitalization and COVID-19 deaths. And on this last slide, I would like to share with you that even by August 12, 2024, the share of people receive at least one dose of COVID-19 vaccine remained very low in some of the African countries and East European countries. I think we need to collaborate with each other and try to increase the vaccine coverage in these low coverage countries. So I think that this is the last slide for the preparation of emerging variant in the near future. We need to have global solidarity and international collaboration. We already have innovative platform to accelerate the development and the licensure of various vaccines in many Asian Pacific countries. But I think, and real world data also show that the effectiveness of several vaccines with high titer of neutralizing antibody at both national and individual level. But vaccination coverage remains low in some countries. So I think we definitely need to help these countries. And the development of next generation vaccine with high efficacy and cost effectiveness and low adverse reaction occurrence and easy mass production and delivery is in need. Of course, we have to avoid misinformation and vaccine hesitancy in order to increase the vaccination coverage. And in these 6 Asian Pacific countries, vaccine hesitancy remained to be problems for some specific age groups. So I consider that we need to help each other, and the continuous global surveillance of any emerging new variant of concern is very essential. And vaccination inequity needs to be reduced through international collaboration. So with that, I would like to conclude my talk here. Thank you very much for your attention.